I was diagnosed at the age of 55, and I found the lump myself. I just started taking some yoga classes, and I'd gone to an early morning class and came home and jumped in the shower and was getting ready for work and felt the lump and went and got a mammogram. They didn't see anything, so they did an ultrasound. And I'll never forget the doctor that did the ultrasound telling me, "Oh, it doesn't look like cancer." I'd always been told with family history in my family was on my father's side with my aunt, that there usually is no connection there. So I wasn't too concerned, and then went in for a biopsy. A few days later, that very same doctor called me back and he said, "I didn't think I'd be having this conversation with you, but you have stage 2 ductal carcinoma." I knew very little about breast cancer before I was diagnosed. So the first thing I did was pick up the phone and call a good friend of mine. Her name is Nancy Nowak. And at the time, she was the chief nursing officer for Intermountain Healthcare and a 2-time breast cancer survivor. So she was tremendous help as a information resource for me and also just a good friend going through the experience. Well, my only family history was on my father's side. My aunt had breast cancer, ultimately took her life. But no, I never thought it would happen to me. It was something that I never thought I would hear or have to experience. Never thought it was going to happen to me. Well, after I was diagnosed, I talked to Nancy and I was trying to educate myself. Obviously, the internet can be a great thing or a very dangerous thing. But the folks at Intermountain Medical Center gave me just a ton of literature to read. And some of it was pertinent to me and some of it wasn't. So it was just a lot to sort of sift through. When I talked to my family, their reaction was really interesting. My husband, of course, was very supportive and went with me to my appointments, was there with me every step of the way. My mother and my brother and my niece and sister-in-law, everybody, they were very nice, very supportive, but I think probably like most cancer patients, maybe, I found myself consoling them and telling them, I'm going to be fine, it's going to be okay. I was diagnosed stage 2 ductal carcinoma, which is an invasive cancer. But stage 2 means that it was still pretty well confined to the breast area. It had grown, obviously, past the first stage, but still pretty much confined to the breast. And my tumor location was actually on the left side, really close to the sternum. Most of the information that I received after I was diagnosed was not really specific to my situation. It was more about breast cancer in general. And so that was a concern of mine, is that's sort of where it started, is that I know I'm not the first and only person to go through this, but I kind of want to find out about what's happening with me specifically. So in terms of the amount of information, there was just a lot to go through. But my personality is I tend to sort of power through things, so I want to get to what more succinct data or information, and what does that really mean to me and my personal situation. And I had a hard time getting to that. Treatment was interesting. One of the great things that Intermountain does is they have this breast cancer center. And Nancy told me about this and that I should go and take advantage of the resources there, which I did. They schedule a time and you go and meet with a group of physicians and providers. They will not necessarily be your physicians or providers, but they went the gamut from radiation and medical oncologists to dietitian, counselors, just everybody there. And I felt good about it, but what I didn't like about it was they were sort of determining this path for me. Well, you're going to have chemo, and then you're going to have surgery, and then you're going to have radiation. And finally, I just spoke up and I said, I feel like decisions are being made for me that I'm not participating in, and I'm not comfortable with that. And one of the physicians said, she just stepped back and she said, "Nope, you're the boss," and she turned around and walked out of the room. And so I thought, well, okay, I'll figure this out. In determining what was the best course of action for me, it was just more how I felt and what I felt was the right thing to do. I had conversations with the medical oncologist that I was going to be seeing. I had conversations with the radiation oncologist. I had conversations with the surgeon, and everyone was suggesting or strongly recommending that I do chemotherapy, but I just couldn't get comfortable with it. And I talked to Nancy about it, and she was great. She didn't tell me what to do. And the reason they were encouraging me to do chemotherapy was because the tumor was so close to the bone, and they couldn't tell if it had actually attached or not. And they wanted to shrink it. And so what finally got me there was I woke up one morning and I thought, well, wait a minute. If I do chemotherapy, there's no guarantee, first of all, that it will shrink. And what if it shrinks closer to the bone? What if it actually, if it isn't attached and that's what causes it to attach? So at that moment, I thought, no, I'm not doing chemotherapy. I want this thing out of my body and away from me. So I called the surgeon and he said, well, okay, I'll do my best. So we went ahead with the lumpectomy. The lingering side effects for me are more associated with the medications that you take subsequent to surgery and the rest of it. I still do have some residual pain in the area, but I haven't tolerated any of the medications very well. So that's really been a struggle for me. In terms of support, I figured that out on my own, and I wish that I would have known. I knew about Susan G. Komen, right? I knew her story. I knew about the organization, but I wish I had contacted the local affiliate, because I remember touring Cancer Wellness House thinking, wow, I wish I'd known about this place, when I was going through treatment. And I wish I'd known about the organizations and the grantees and all of the good programs that Komen supports. So I just kind of, again, found my way and through friends and family, and I just remember Nancy saying to me, I think you did the right thing. I couldn't tell you don't do this or do that, but I think you chose the right path. There are burdens that exist, and not sort of feeling victimized or feeling sorry for myself, but people are so well-intentioned, and everyone wants to help, and everyone has advice for you. But there's still sort of a loneliness factor to it, in terms of you're either part of the group and going down this particular path, and if you choose to deviate from that, then you're sort of the heretic out there on your own kind of a thing. And that's kind of how it felt. And you feel like your body is, I don't know, like I said, I just wanted the cancer out. I wanted to just step away from my body and maybe go get a new one. You don't feel pretty or attractive, or you just feel like there's just something bad going on, and you want to sort of walk away from that. But in many respects, I'm very fortunate. I had insurance. I had resources to cover things that the insurance didn't cover, and I just, I can't imagine not having that kind of support. My biggest supporter was my husband. He, obviously, we've been married for 30 years. He's used to my rants and he would just sit there and listen and hold me when I needed to be held, and those things. He went to the doctor appointments with me. He went to a lot of treatment appointments with me. But amazingly enough, some of the biggest supporters that I had were people that I just met, other survivors who would come up and hug you and say, you're going to be all right. And they didn't know me, or they didn't know anything about me. They didn't try and say, here's what I did, so here's what you should do, sort of a thing. And now I found a lot of support and solace in that. I think that was, it's such a wonderful community, and people don't know about it. The advice that I would have for someone who is newly diagnosed is to educate yourself, advocate for yourself. Don't be afraid to ask questions and do that. And a piece of advice that I got early on from Nancy was to take time for myself. And I absolutely did not do that. And so if I have a learning experience that I could pass along to someone else, it would be that very thing, because I took 1 week off work. That's it. I scheduled all my radiation appointments after work. I just, like I said, I powered through it, and I ended up hitting a big, hard wall. And so if I had taken the time to just say, you know what, I probably ought to stay home today and reflect, or I should probably do something for myself today that I don't ordinarily do, or go just experience something that I don't ordinarily do on a Monday through Friday, I think I would have benefited greatly from that. So I would give that advice to anyone who's newly diagnosed. The way I got involved with Komen was I felt, I know this sounds a little crazy, I felt very fortunate to be where I'm at and to have gotten through it, but there's also a little twinge of guilt, because I know there are a lot of women out there who struggle was a lot more difficult than mine has been. And so I wanted to do something for them. I wanted to try to sort of give back, to be cliche. And so I reached out to my friend Bill Nelson and said, how do I find out where to go or who to talk to, or how can I get involved? And so he had someone contact me, and they put me in touch with the Cancer Wellness House and with Susan G. Komen. And I talked to both and realized with Komen, if I joined the board, I could also help Cancer Wellness House because they were a grantee, so it was sort of a no-brainer. I met Coralie Alder and I met Debbie, and I decided to join the board, and it's been a great experience for me. Wonderful people, wonderful organization, and so I saw that as a way that I could make a difference.